Namaste everyone. Testicular cancer, though it is the most uncommon type, it can affect the men between the ages of 15 to 45. April month is regarded as the Testicular Cancer Awareness Month, and to know more about it, we have with us Dr. Srivatsa N, Consultant Uro-Oncologist and Robotic Surgeon at Shankara Cancer Hospital and Research Center, Bangalore. I welcome Dr. Srivatsa N to our program.
Namaste everyone. Thank you very much, Shambhavi.
So to begin with, sir, what is actually testicular cancer? Cancer
that develops from within testis is called as testicular cancer. Like you mentioned, it is a very uncommon cancer, representing only about 1% of all cancers that are encountered in the world. However, it accounts for about 5% of all urological cancers, and the sad part is that testicular cancers typically affect young men who are otherwise fully physically fit and full of life. So, testicular cancer, though uncommon, affects men in their peak productive age group, and therefore it's important for us to know more about testicular cancer and make all efforts possible to spread awareness so that patients can be identified early, treated early, and completely cured.
So now that we know what is meant by testicular cancer, I would want to ask what are the risk factors or the causes of this testicular cancer?
Unlike cancers from the other organ systems, a vast majority of testicular cancers have no specified etiological or risk factors associated with them. Having said that, however, there are a distinct subset of men who have a higher predisposition to develop testicular cancer. They are those who do not have their testicles descended into the scrotal sac. So we all know that the child when born will have both the testicles descended into the scrotal sac, which are palpable. There are some children who will not have one or both their testicles completely descended into the scrotum. We call this condition as undescended testis. So in such children, if this phenomena goes unnoticed by either the doctor who sees the child in the first instance or by the parents, will eventually over a period of time develop testicular cancers. So by and large, this is the most common and also the most correctable cause to prevent testicular cancer. The second risk factor for developing testicular cancer is what we call as disorders of sexual differentiation. It's a very complex entity, may not be very well identified clinically. However, if a particular male child has been exposed to certain chemicals when the mother is carrying the child, will have varying degrees of testicular dysgenesis, or meaning to say the complete normal maturation of the organ would not have happened. And in such children, there will be an element of testicular dysfunction which can predispose these children to develop testicular cancers.
So, how are these testicular cancers diagnosed? And that comes to the question of what are the major signs and symptoms of this testicular cancer?
Again, very important for all of us to know. I recently mentioned to you that non-descent of testis in itself is a major risk factor. So I would like to use this opportunity to educate all new parents who have had a male child to periodically examine the scrotum of the child to ensure that the testis is in normal position. both testes, both the right and the left testes are in normal position. If during the growth of the child there is a variation in the size of the testicle, either the right side or the left side, then it is probably advisable that they consult the treating pediatrician or a urologist to ensure that there is no abnormality involved. Whenever a child is identified to have undescended testes, the testes should be brought back to the scrotum by a surgical procedure to ensure that there is no pathological factor which will drive that undescended testis to become cancerous. This is very important for more than one reason. Like I mentioned, if the testis is undescended, it increases the risk of development of testicular cancer. And by bringing it down into the scrotum, the risk not only gets mitigated by a substantial percentage, it also becomes easy for either the patient or the parents to monitor, to inspect, to touch, to feel, to monitor the size of the testis. And therefore, even in an untoward situation where there is development of a tumor in that undescended testis, it is amenable for examination and early identification. So, it is important for us to identify any child with an undescended testis and get it corrected as soon as possible. In fact, we do it now within the time the child completes its first birthday. So, if we are able to achieve this, then the potential increase in risk for developing testicular cancers is almost mitigated. Now coming back to the original question that you asked, the question about signs and symptoms. A vast majority of early stage testicular cancers do not show any symptoms. However, there is a painless, gradual, steady increase in the size of the affected testis. So, if we examine, or even if the individual self-examines the testis, the individual will find that there is a discrepancy in the size between both the testicles. So the affected testis will start enlarging in size, but the testis will typically not be painful, and majority of the times increased size of the testis is identified when patients undergo a trauma. This is what we commonly encounter in practice, where patients come back and say that I was playing and then I had an injury to the groin area, and then when I examined there was a swelling. It is not resolving, and therefore I have come to you for further evaluation. So increase in size, typically painless in nature, is probably the first sign of testicular tumor. As the size of the testicular tumor increases, patients can start developing mild symptoms like dragging, pain in the scrotum, or a pull in the groin. This should also warrant them to go back to their doctors and get evaluated. In advanced stages, testicular cancers can present like any other cancers in advanced stage with weakness, loss of appetite, loss of weight, back pain, bone pains, so on and so forth.
How this testicular cancer is treated? What are the different treatment options that are available for this cancer? How is it diagnosed, the testicular cancer? I would like to ask if a self-exam of the testis is recommended.